And one of the things that we wondered when we started this project is if you're facing these normal stressful moments during your child's infancy or toddlerhood, how would you respond if you had in fact had those types of stressors in your past? If you had been yelled at as a child, for example, and then your child yells at you like a colicky baby is doing, how do you respond? And it turns out with this mother that she had been experiencing a lot of stress related to this baby's colic that was probably disproportionate to the majority of parents who experience a colicky baby. And so when we had the conversation about how her childhood affected her parenting, she talked about how she had not really been doing any sort of self-care through the course of having this colicky infant. And so we talked a lot about things that she could do to take care of herself while she was taking care of her baby, which I always think is one of the first steps in parenting. We use the analogy of the airplane that you put the oxygen mask on first before helping others. And this mom had not been doing that. And so we talked about ways that the mom could take care of herself first. And over the next couple months, her stress level dropped dramatically. And when she came in for subsequent visits, I asked her, how are things going? How are you taking care of yourself? And she was able to respond that she was doing a much better job taking care of herself, and that made her more available for her children. One of the major factors in resilience that is important for people resisting the effects of toxic stress is connection. And I think that's true for parents as well, that if parents are in isolation, they're not going to do as well as if they have a network of friends and other people who care for them and help them take care of their child.